before I start my lecture, I would like to thank some special people that were, let's say, very important in my life. In the first place, Antonín Holý, Tonda Holý, and I discovered Holý in, was in fact my first discovery in my life, and that was in 1976. We were both at a meeting in Göttingen, in Germany. He was there from the East European side, I was there from the West, and somehow we decided to join each other in our attempts to try to find a cure, not for AIDS yet, that came much later because AIDS did not exist at that time, or at least was not recognized as a disease at that time. But this was the first time that I met with Dr. Holý, and we stayed in the beginning, let's say, good colleagues. Later on, we became actually close friends. In our relationship, I would say that Holý, although he was only 5 years older than me, I excuse that I'm also pretty old, and so he was like a father for me, and certainly a father as far as the chemistry is concerned. So this is certainly the first person I wanted to mention here up front, and I will come back at the end of my talk to other recognitions, but after the discovery I made in 1976, I made a second discovery that was in 2007. Thanks to Dr. Holý, I discovered a certain gentleman from a place I never heard of before. And this was Český Budějovice. It took me, don't worry, it took me 2 years before I could pronounce it decently. The men always told me that I should pronounce it as Budweis, but I think that is not really a flattering name for it. I think Český Budějovice sounds more authentic, and this was Libor Grupover. And I would like to ask the public a kind of applause for what Libor has meant for me. And then in 2014, I made another discovery. This time it was a Chinese. That is also unexpected. And he had been studied with us and did his PhD with a colleague of mine, not with myself, but I discovered him after the graduation, at the reception, of course. That's where I do most of my discoveries. And so this is Guangdi Li, and may I ask your applause for Guangdi Li? It's a real Chinese name. The nickname is Louis. Louis, are you? Okay, applause. He has been really of enormous help for me in all aspects, also, you know, in intellectual and physical way. And I think I'm extremely grateful for his help, and I hope that I can count on his help for the future for as long as I will be able to, let's say, walk or try to walk and try to give speeches. So this time, I mean, I would switch to my presentation. So, and it is the first time that I will talk about the post and pre-Holý at what I would say area. So like you talk about pre-Jesus Christ and post-Jesus Christ. For me, it is pre-Holý and post-Holý. So in the first place, I would like to talk about pre-Holý. And then I will switch to the post-Holý. The next slide, let's try. So this apparently is a unique picture. It's the first time I showed this picture for a, let's say, private or public audience. And this is how I must have looked like in 1969. So 1969, I spent, from that date, 2 years, 2 months and 2 weeks and 2 days at Stanford University in the medical school. And my boss there was this gentleman, and that is Thomas Merrigan. And Tom Merrigan was one of the youngest professors in Stanford, and he's only 6 years older than I am, and as far as I know, he's still 6 years older. And that is, now is 6 years old, it must be something like 83, still living quite well in the neighborhood of his home place, his university, I think in Porto Valley, with a view on the Golden Gate, or at least a view on the downtown San Francisco. That is where I spent 2 years and 2 months, and as I said, and this was on interferon. So my career started with interferon. Next. And as this lecture, and as always been the case in my life, I will, let's say, stress in this lecture also on chemical structures. Some of you know that I've addicted to chemical structures. The first thing I would say up front, that even if I'm addicted to chemical structures, I've never synthesized myself one compound. But as good painters or made to be admired, I always admired the chemical structures of those that have synthesized it, including, of course, Dr. Holý. So, and in the beginning, I worked with compounds like polyacrylic acid, polymetacrylic acid, and pyran copolymer, and these were in these years, I mean, I'm talking about the 60s, synthesized as inducers of interferon. Interferon was discovered back in 1957 by Isaacs and Lindemann over in Mill Hill in London. And that, I say, stimulated the interest of my chief, my mentor, Professor de Zomer. And you must see that in the context of these times, de Zomer at first paid attention to penicillin, and this was before my time. Then he switched to the use of a polio vaccine. This was again before my time. And then he switched to interferon. And he tried to make me enthusiastic for interferon, and I followed him, and so tried then to find inducers of interferon. Just at the same time that also Tom Merrigan at Stanford was doing the same kind of work. He made the synthesis or the discovery of pyran copolymer, and I synthesized, or I say not synthesized, but studied the polyacrylic acid. Next one, yeah. So that resulted already in these early days. I mean, I'm talking about 1968, exactly 50 years ago, in 2 publications that had de Zomer's name first. I've written these publications, although my name is second. De Zomer has never written one word of it. He has not even seen the papers. But this was the case in these days, and I never questioned this. This was normal. I was personally very much honored to be the second after him, to have my name just following his name. And I could tell you a lot of anecdotes on the creation of these papers that were published in distinguished, not, let's say, not Science or Nature, but at least in Journal of Virology, was one of the first issues of that journal. And I remember that we had 3 papers that we submitted at the same time, and finally only 2 of them were accepted. These were also the first papers that I have written ever myself, and since my English was absolutely, I would even say, mediocre to non-existent, then we had to send the papers for correction to an American-based bureau who was writing the papers in English. And that was at the indication of the Sommer. When his name was the first one, that was only because he suggested that we should send it for writing to this bureau in the United States. But this I remember, and I still consider this as really the beginning of my career. Personally, I then with the Sommer later on, I was recognized. The Sommer told me that from now on I could be the first author, and then, you know, I wrote about 2 papers which were authored by myself and the Sommer. This was all before I went to the United States. Then he was the one that suggested I should get some training in the US, and he suggested 3 possible places. One was, yeah, you're too fast. One was to go to Johns Hopkins in Baltimore and to work with a certain Bob Wagner. Second proposition was to go to New York to work at the Bronx with Phil Marcus, who was at that time an, let's say, very well-known figure in the area of interferon. And the third one was to go to Stanford and to work with Tom Merrigan. After, you know, some deliberation with my wife, we decided to go to Stanford because it was located in California and located under what was said and close to San Francisco. That meant for us a real experience, and it was an experience. I mean, in terms of the climate, that is one thing, but certainly in terms of the scientific environment. You must realize Stanford is still in the leading of one of the leading universities in the world, but at that time it had a department of biochemistry that was by far the #1 there. And when I went to Stanford, and now we go to the next, the reason was that at that time a certain group at Merck, headed by Maurice Hillman, had just published on the fact that you could induce interferon with a double-stranded RNA. And I was particularly fascinated by this discovery, double-stranded RNA, as you can see here. These are pictures which are perhaps not very much up to date, but I have here shown the original picture that I showed already in these early days of the double-stranded RNA with the 1 strand here and the 1 strand there. Normally it makes a double-stranded helix, but here a little bit redrawn according to my own imagination. And so that it was at that time what I would consider the #1 compound in the world, a very efficient inducer of interferon, and as we expected that interferon would be the panacea for the treatment of virus infections, we thought that poly-IC would finally also emerge as the most important drug for the treatment of virus infections through the induction of interferon. Unfortunately, poly-I, poly-C was also quite toxic, and finally it was never developed for the treatment of any virus. And so the compound somehow died within the company where it had been discovered, that was Merck. But for me, this compound was a kind of a stimulus. In French, we would say un coup de fouet. That means a kind of a real, very big weapon to, you know, get working in this area. So my original days, the pre-Holý area was devoted to find an ideal inducer of interferon. So this is the original paper. It dates from 1967, and you will see that it was published in the PNAS, and the man I refer to is the director of the group was Maurice Hilleman. The first author was Field, and I still kept very good contacts with Field. His name was A. Key. I never knew what the A was standing for, but the K was standing for Clercq. So his name was Clercq Field. And this was the paper that really stimulated my research also at Stanford. So then shortly after the poly-I, poly-C had been published, and starting with my own research at Stanford, we discovered this compound as a very potent inducer of interferon. It's a poly-thio-A, thio-U. The compound was again not synthesized by myself, but synthesized by Fritz Eckstein in Göttingen. The Max Planck Institute für Medicine Chemie, and that compound was then sent to us, to Madigan and myself at Stanford. It resulted in my one of my first papers already in Science, and that dates from 1969. So you see the authors, myself with Eckstein, who had synthesized the compound himself. The compound is perhaps the first in my, let's say, series of compounds which I would bring to the market. It was, at a certain time, licensed by Stanford University to a company called Wyatt. Wyatt does no longer exist. But at that time, Wyatt had taken a license on this compound for a potential clinical application. After 2 or 3 years later, then they abandoned, and so the compound died in the hands of Wyatt and was never taken up by any other company. But the compound had some, let's say, for me, some significance in the sense that the very first royalties that I ever received in my life, if only a few dollars, but more symbolic than useful, but that was due to the, let's say, the use of potential usefulness of this compound. It was the very first of the compounds that ever gave me some profit, but I said, do not exaggerate this, we had a few dollars, no more, but Stanford was, obliged to also give that to the inventors, and since I was one of the inventors, it had a symbolic significance for me. So this was my very first attempt, long before I ever met Dr. Holý. Then now I'm going to skip several years. And the next important step that happened in 1980, that was after I had already met Holý in 1976, but in the meantime, of course, I was still working along the interferon lines. Then it was the professor of Ghent, Professor Walter Fierce, who is 10 years older than I am, and heard that he is still alive, but not doing so very well, so he certainly will not be able to give a presentation anymore. But this was, at that time, a very important, let's say, breakthrough in the interferon field, because we then had 2 papers in the same year in Nature, and that was on the use of, again, poly-I, poly-C, to characterize the complete molecular structure of interferon. That was shown in the first paper, and then further on to the expression of interferon. So interferon later on, this kind of interferon has been used in the treatment of multiple sclerosis, MS, and that originated actually from these observations. You can see that my name is somewhere in the middle. That's let's say an unimportant place, but the first author was Erik De Clercq, and this Rick has further pursued his career in the US. He then moved to Genentech and later on to the University of South California, or no, North California in San Francisco, south in the Bay Area. And I lost track. I would like to know what happened with him, but he must still be in the US. It was based on this observation of which he was the first author. And so the boss was at that time was Walter Fierce, but it was actually what I would say my last achievement in the interferon field. After this had happened, I was ready to switch to the previous slide. This to switch to the nucleosides. And now, yes, you can see here, this next slide, I've put this picture on, especially for Louis. Louis, can you see one of your colleagues? Is clearly a Chinese. And he was the first Chinese ever allowed to leave China. This was in 1979. And I remember that Professor de Zomer, my boss, my mentor, once when he came to the institute, wanted to see me, and he said to me, "I have a present for you." And I was not used to receive presents from my boss, so I was a little suspicious about it. And then he finally said, "Well, my present is right outside the office here," and there I saw a Chinese. And so I asked him, "How long did it take to come from China? From where are you in China?" It was obviously from Beijing. And he said, "Oh, 5 minutes." I said, 5 minutes? Apparently his knowledge of English was not really appropriate. And so what he meant that he had made it in 5 minutes from the city hall to the institute. But that, I remember, was my first encounter with Zhang Zhengxi. I mean, it's, I do not know what afterwards happened. He spent a few years with me, and that is shown on the next slide. So here on the publications we had together, I've digged this up among my publications, and there were about 10 publications. I would not say in very great journals. There is no Nature or no Science involved here, but there are 10 publications in the period from 1980 till 1983. And then Mr. Zhang, or Dr. Zhang, because he was a medical doctor, had to return to China, and he did not want to return. So that was a problem, not for me, but a problem for Professor de Zomer, because I received a present from him, so he had to be responsible. Also, if the present was not, let's say, behaving as he had expected. So in that case, I mean, he ran into problems with the embassy of China in Brussels, and he told me that it was absolutely obligatory for Dr. Zhang to return to Beijing. And he did not receive any, what I would say, fellowship to return, so he had to go back by train, which means a Trans-Siberian train, out of Brussels to Beijing, 2 weeks at least at that time. And As soon as Zhang was back in China, he then arranged for everything to escape to the US, and with his family, wife and 2 daughters, he finally settled in the US and in the area of Boston, but I do not know what further happened with him. So, but it was, I mean, I mentioned that in this context because he was the very first Chinese that was released to Belgium. I do not know, maybe at the same time others were released to other European countries, but for Belgium he was the first. De Zomer was about the most important man in Belgium, so he got the honor to receive him in the Institute, and I was somehow then the favorite co-worker of De Zomer, so I got then the honor to receive this present. But things have changed now, and if you come and have a chance to visit us in the Rega Institute, it is full of Chinese. I mean, it's you can stumble almost over the Chinese there. So things have changed drastically. But he was by far the very first. And to return to, there are 2 other people on, no, is one other because return to the previous one. So here you can recognize this is not a Chinese. That is, I mean, look like it, but that was how I looked like in 1980. And this is a technician of mine, Willy, and Willy would, I mean, if he would be present here, he's still alive. I mean, he's younger than I am, and he helped me certainly in the work that I did on interferon together with Walter Fiers. So he was involved in the program on the induction of messenger RNA for interferon, and so he played a very useful task in that, and that's the reason why, I forgot for what reason, we were ever here pictured together. It was done at the occasion of a kind of a journalist happening, because the picture is taken by a very good photographer of our journal, the Standard, the best known journal that we have. I mean, it's you see, we do not publish papers in Czech, but in Flemish language. So also this I have to mention here to show you that I had also ladies working in the lab, because otherwise you would think that I had only men. So this was one of my favorite technicians, and you see a few other faces. And you see that we had a pretty crowded laboratory. I mean, we did not have much space, and everybody had to work on a very few square meters. This is only a picture to show you a site on my laboratory in these very old days, and that I should not give the impression that I did all this work by myself, but I had, technicians, male and females, more females than males. Yes. Then slowly come to the topic here of almost the post-Holý or the Holý area is the compound that you show here is suramine. Suramine, I would say, is the opening to the era of the HIV compounds. Normally, when people are, introduced into the anti-AIDS chemotherapy, they generally think that AZT was the first compound. That is not true. I had already described this compound, which is an hexasulfonate with 3 sulfonates at this side and 3 sulfonates. It is perfectly symmetrical, and 3 sulfonates at this side. And suramine has been a compound that has been around since 1920 for the treatment of sleeping sickness. And I discovered by chance as most of the discoveries are made by chance. We have a word for that in English that means serendipitously, and that is by chance. And this compound I discovered that as an reverse transcriptase inhibitor. When I say I, then normally I would say we, but in this case, I did this by myself, even with my own hands, and even without the Sommer knowing what I was doing. So just to prove that I did this really by myself. And in these days, I'm talking about 1975, the belief was that reverse transcriptase played a role in the origin of cancer. And the advocate of that theory was a certain Saul Spiegelman in the US, and he was a member of the National Academy. He published one paper after the other in the PNAS. And I was very much fascinated by all these publications and thinking that they were all correct and could be followed up. So I thought that, well, now I found myself an inhibitor of the reverse transcriptase. Maybe this will be the cure for cancer. You can imagine how naive I was in these days. But anyway, so without telling anybody, even not, except maybe my wife, I was injecting mice with leukemia cells and then treating these mice with suramine to see whether the theory was actually valid, that suramine would be, or that an inhibitor of the reverse transcriptase would be inhibiting the origin or the appearance of cancer. The results were completely negative. And then I had perhaps two, let's say, things to do, either to commit suicide, but I didn't do that, or just to forget about the possibility that reverse transcriptase was involved in cancer. And I told this when, 3 years later, in 1978, Bob Gallo visited us. And Bob and I became actually good friends. And I told him about this discovery, and I said that I had no intention to ever report that because all the results were negative. But he said, but no, I mean, it is important that you found this compound to be effective against the reverse transcriptase. Even if you have no activity against cancer, you never know why the reverse transcriptase may sometime become important. This was in 1978, a few years before HIV, or even many years before HIV was discovered, but certainly before AIDS was identified. And I asked then Bob Gallo, where should I submit this? Because I did not really thought that a big journal would ever take this observation. Then he said, oh, I'll send it to my journal. And this was Cancer Letters. In the next slide was a journal. Here you can see that I'm the only author, and that's obvious because nobody else knew that what I was doing. And it was finally published as a title, Suramine, a potent inhibitor of the reverse transcriptase of RNA tumor viruses. So, and Gallo was at that time the editor-in-chief, and this is perhaps the only paper in my career of what Eva said would be 3,000, actually not 3,000, but 2,800, something like that. And it is perhaps one of my only papers that was ever published without revision. So that is why I have good memories of it. It's not a highly labeled journal, but anyway, it was my only paper ever published without any revision. So then, much to my surprise, came a few years later. I had already forgotten about suramine, and I received suddenly a call from the US. It was even at home that a certain some brother called me to congratulate me. I could not understand what he was me congratulating for, but then apparently I understood he was congratulating himself because he had just received news from Science that his paper had been published in Science, and it was Hiroaki Mitsuya and co-workers, including a Czech. You could recognize Popovich, you probably know him, and so you can see then the other names. And Bob Gallo was an author of this paper, and then some brother was the one who called me. He was at that time the senior author of this paper. And what it had done, that based on my publication in Cancer Letters in 1979, they had studied the potential of suramine to see whether it could inhibit the infectivity of HTLV3, and at that time that was the name used for HIV. And I should say for the audience that the term HIV only dates from 1987, when it was decided to name it as HIV, after there was a lot of controversy whether they should use the American abbreviation HTLV3 or the French abbreviation LAV. And so to finally resolve the question, they came up with the term HIV. But that was only in 1987. So that means that when suramine was found to be effective against this virus, it was still called in the old-fashioned HTLV3, HTLV standing for the human T leukemic virus type 3. Actually, it was later then the L changed a little bit of an aesthetic intervention to lymphotropic. But originally it was the L for leukemia, and later on changed to lymphotropic. And this paper was the very first ever published on the activity of any compound against HIV. So I've just gone through that original paper. In the paper you can read that all retroviruses and so on, and then they refer to, this is ad verbatim, taken from the paper, that De Clercq reported that suramine, with the molecular weight drug and so on, that is used in the treatment of sleeping sickness, was a competitive inhibitor of the reverse transcriptase. And this gave then the impetus, I would say the stimulus, to some brother to start exploring the potential of this compound in the treatment of HIV infections. You can also see what made them to do this is that this was based on the observation of Baltimore and Temen. I mean, you can see them here in their papers in Nature in 1990. So I'm cited as one of the next one to that. So let's say that I'm in good company here. It's Baltimore and Temen for this observation were later credited with the Nobel Prize. Very shortly after that time, this was in 1970, and in 1975 they were already given, together with Renato De Clercq, the Nobel Prize for this finding. Renato De Clercq for the general, let's say, exploration of the herpes or other virus replications. Okay, so then the next year, that was after 1974, in 1984, then in 1985, Broder and his colleagues then also reported that suramine was effective in patients. And that is illustrated on the following slide. And I just indicate, I think patient 4 is the most illustrative. So as long as you have your suramine within the blood, and that is building up, like you see here, this gives you the pharmacokinetics of suramine, and when you get the highest level, then the virus completely disappears. And when you stop the use of suramine at this point, then of course the suramine will be slowly disappearing from the blood, and at the same time you see the virus coming up again. And this is an original picture from that paper in 1985. You can see it. I mean, the full document is indicated. It was a paper in the Lancet, and that indicates a principle which is still holding today. That is, as long as you have the compound available and is building up in the blood, you can completely suppress the virus. But you do not eliminate it. You just suppress it. And when you stop the administration of the compound, the virus will come back. A principle which already dates from 1985 and which still holds now so many years later. I just give it this as an historical picture. The compound itself, suramine, was later abandoned for two reasons. That is, first of all, it was too toxic. And second reason was AZT was in the meantime discovered also by Mitsuya, Broder, and Gallo again. And so in that compound, AZT appeared to be much less toxic than suramine. And surprisingly, we have now much better compounds than AZT. Tenofovir is certainly much better, and compound which I described in collaboration with Holý. But the principle that I at that time had proposed for suramine still was of basic importance. So that means as long as the compound was around, you could completely suppress the virus. Okay, I guess that's time to switch now from the pre-Christus time to the post-Christus time. And the switch is here, the very first compound that I co-discovered with Holý. From now on, we come to the Holý time. And so Holý, I would say, was very influential in convincing a company at that time, a certain Lakema. I've never, or maybe only once, met some representatives of this company. They are located in Prague, somewhere in Prague, I do not know where. And this was based on the compound, the first compound that I ever found to be effective out of the compounds coming from Holý. That brings me to how I got into contact with him. So after we had met in Göttingen, he decided to test me by sending me 3 compounds for testing. He, must say, was Tony Holý, by nature a suspicious man. I mean, very careful, but actually also very suspicious. I hope that all chemists are that. They are very suspicious with regard to the compounds that they develop. And so he certainly was very suspicious with regard to myself, because I said, what is this medical doctor doing in this chemical environment? And so he said, is that true that he would be eager to test our compounds? Let's see and try it. Send him 3 compounds. Okay. He expected that all these 3 compounds would be inactive. But to my big, and to his big surprise as well, we found one of the compounds, 1 out of the 3, so that was a success rate of 33%. we found one of the compounds to be effective against certain herpes viruses, and as we found out much later, that this was due to the inhibition of the S-adenosyl homocysteine hydrolase. At that time, neither Holý nor myself were aware of the enzyme, the S-adenosyl homocysteine hydrolase, to be a good target. It was actually work of Ivan Votruba that brought us on, let's say, this track. And it actually, in the meantime, Holý was very, let's say, enthusiastic about that. We got the paper published in the, let's get that in the next slide. So I've seen enough of this compound. Here I describe what I've already told you, but the paper was published here in Science. And this was my very first paper with Antonín Holý in Science. You see here, well, I did not indicate all the other authors, but my boss, De Zomer, is also on this paper. And not only De Zomer, but of course also Antonín Holý. So, and we published in Science, and Holý himself was then capable of getting Lachema to further pursue the clinical application. This was for the treatment of cold sores or herpes labialis, and that was really based on Dr. Holý's idea. And he told me that the fever blisters all disappeared after putting the compound on the Vira gel on these lesions. I told that to Dr. Holý as a medical doctor, so sometimes I changed from chemist to a medical doctor. I told him that the fever blisters, common sores, were always disappearing. If it is not within 7 days, then it would be within 8 days, but they will never last for more than, say, a week or two. Certainly not in the normal immunocompetent patients. In immunosuppressed patients, it's another story. And there, sometimes, even a very trivial disease like herpes labialis can be detrimental and can even be lethal. So it is not, let's say, so trivial to consider a treatment for herpes labialis as being unimportant. It can sometimes be really life-saving in certain patients. But anyway, that is how my story started with DHPA. Then at the same time, at about the same period, I had discovered BVDU. Again, I could say that I played a major role in this compound. So compound BVDU is a little bit tailored after IDU and TFT, compounds which have been on the market already for almost 60, 70 years. I think IDU was the first one to be described in 1959. Well, if you count quickly, you can see how long it has taken then, how long this compound has been on the market. Well, BVDU we discovered due to my collaboration I had with Dick Walker at the University of Birmingham in the UK. Not in Alabama this time, but in the UK. And this compound has had a very long, let's say, a trip to make. I mean, we did not know that at the beginning. When we described this compound first in 1979, that was described in the PNAS with Bernard Wittkop as the sponsor. Then we had already made an agreement with the company Searle in the UK, in the United Kingdom, and they were going to pursue the further development of this compound. But then the third branch in the United Kingdom got into conflict with the third branch in the United States, and as actually a result of this conflict, they dropped in the US everything that had been found interesting in the UK. So the company was dropped and the compound followed what happened with the compound. So we were, that happened in 1984, left as, for this compound, as, let's say, parents or orphans without parents. And this later happened again later for the acyclic nucleoside phosphonate. So we were already, or I personally, was already, let's say, introduced to failures. And so I have, with this compound, spent an odyssey in the sense that many other companies I contacted were all very enthusiastic at first glance, but lost their enthusiasm at second glance, and they all turned down. Beecham turned us down, Astra turned us down. So the only place on earth where the compound still got interest was the DDR, East Germany. And this explains why, for a while, when traveling to the East, I had to make a choice between traveling to Czechoslovakia or to East Berlin. And many times, I think 5 times that I remember, I traveled to East Berlin, and then the East Germans, then they were too fast. The East Germans were then able to commercialize the compound in East Germany. They just made the same compound over in East Berlin, did not care about the patents. Of course, they knew that we are not going to fight patents in East Germany. I mean, that was very clear. But yes, sure. How many minutes?
Some, of course.
Okay, from now on I have to
sure
be...
that you are running out of time.
Already?
Yeah.
I see, yeah. I knew that I had that risk. But, okay, from now on I have to make it very short, because this is only even not in the 1/3 of my lecture, but... and I should like to tell you so much more about Holý. So this compound, let's make it very short now. This compound finally made it to the market, but that was thanks to the efforts of the East Germans, and then the company that was in East Germany, in East Berlin, was Berlin Chemie, was taken over by the Italians, and the Italian company Minarini was then responsible for launching the compound in many countries, including also Italy, also Belgium, I think also China, and so that got then different names according to the different countries. The application of this compound is the treatment of a zoster, shingles or chickenpox, and that is the application. And now the compound is, of course, generic, but it's still the best compound that could be used, or that has been found useful in the treatment of shingles zoster. Okay, so let's skip this one. And so before I go into Holý's compounds, one of the compounds of which I've also been credited as discoverer is Acyclovir, which is the successor of Acyclovir. I did not discover Acyclovir. That is, that has already been credited with the Nobel Prize to Trudy Ellion, but I can say that I got a hand in this compound, Valtrex or Zelitrex. And that is the valine ester of Acyclovir. has proven to be superior to Acyclovir because it can be orally absorbed and so achieve higher levels in the oral absorption than Acyclovir. But the indications are the same. This is for all kinds of herpes simplex virus infections, both type 1 and type 2. Okay, let's skip and go then to Holý's next time. And that starts, this is the basic compound that we developed, that is HPAPA. And this was the subject of the next slide, the paper that we published in Nature in 1986. So this was the second paper, but there were others in between, but this was the second breakthrough paper, the first one being in Science, and this one in Nature 1986. I remember very well, it is perhaps my most important paper that I ever published, so Holý's name is second to mine here on this paper, and that was in 1986, okay? So here you see, and well, this is very interesting. I think maybe you know this man here. Ivan? Yeah, okay. So, and this was Sakuma, was in Japanese, working at the time with us. I will not talk about this man. And Motkal was not the chief, but the friend of mine, I mean, ophthalmologist. And he indicated at that time, or he had shown that this compound was effective against some kind of ocular infections. I personally, with that compound, the previous one, and I give that as an anecdote, I've treated one patient myself with this compound. It was not commercialized, but I had a very dear patient that I ever personally, gave this compound to. This was my father-in-law. And when you talk about father-in-law, that means that his daughter must have been my wife. And that is the reason my wife insisted that I would treat her father with my compound. It was not my decision, because I hesitated, of course, and this was not what you could call very legal, to treat your own father-in-law with compound. But the compound was finally not commercialized, but he was suffering from an adenovirus infection, and the diagnosis was confirmed by my good friend, the ophthalmologist, Prabhat Motkal, and he said, yes, now, I can confirm it is an adenovirus infection. Now the ball is in your camp. If you want to treat it, it's open to you. And that is how I treated my father-in-law. And needless to say that he recovered almost immediately. But so maybe if he would not have been treated, he would also have recovered rather quickly. But at least he did not have to take the compound for more than 1 or 2 days. So it went very fast. And okay, so now we switch. Then at that same time, I report on PMEA. That was in the same paper. So Ivan should remember that he also had PMEA, was mentioned in that paper. PMEA was originally pursued for the treatment of HIV infections, but it was considered to be too toxic for this indication, and it was finally then further pursued at Gilead. Next slide. For Gilead for the treatment of HBV infections. So the name of this compound for which it has been used was Apsera, and it is still used for this indication. Then third compound of the series was Zadovavir, and that also came, of course, through our collaboration with Dr. Holý. Zadovavir has been approved. It was the first approved compound for the treatment of CMV retinitis that happened in 1995. And that was at that time an important and very dangerous infection in AIDS patients. But now we have found so many good compounds for the treatment of AIDS that the complication of CMV retinitis is no longer seen in these patients. So it looks like with our own compounds, we sometimes undermine the market by just treating it with more effective compounds, so we then lose the opportunity to extend the potential use of our other compounds. And so Zadovavir is now out of patent protection, but it was the compound ever established for the treatment of CMV retinitis. Now, an indication for Zadovavir is that it could also be used off-label, as we call it, for the treatment of other infections like papilloma, polyoma adeno, and pox virus infections. Off-label, that means that not through prescription, but just on a compassionate basis. So how many more minutes, Mr. Chairman? Yeah, I should, Mr. Chairman, you're the chairperson.
Just maybe 10 minutes.
10 minutes, okay. That is allowed by the audience? Yeah, okay, okay. 10 minutes. So this is not a compound that was developed by Dr. Holý. This was actually synthesized by our colleague Piet Herdeman at the Institute in Rega. And we were the first, next slide, we were the first to come up with that compound, this D14. But we had some competitors, I mean, at the Yale University, they also had synthesized, that is Bill Prusov and his co-worker. And then in Japan, Naoki Yamamoto in Tokyo had also proven this compound to be effective against HIV infection. We were the first, but after a long battle, and I personally did not really want to go on with this battle for the rights of this compound. We should, if we would have, continued to, get this battle against Yale University, but I did not want to fight against Yale, because that would be a fight like David against Goliath. So we then decided no further to pursue this, or I decided no further to pursue it, but the compound was finally then further licensed by the company Bristol Myers, when it was still Bristol Myers, now it is Bristol Myers Squibb. But these papers that I indicate here indicate that we were the first with Masanori Baba, and I'm a part of this picture, and the paper that appeared in Science, in Biophysical Research Communication in January 1987. Then Lin and Prusov came up in July 1987, and then the Japanese, with Hamamoto as the first author, came up with this story in July 1987. Faster. Okay. Hept is a Japanese compound, okay, I skipped it because I skipped that. Thibault is our compound that we developed in collaboration with Janssen Pharmaceutics. Next one. I'm going to skip this. The most beautiful compound in terms of, let's go back to, you can see this here as a non-chemist, but as a kind of an artist. I'm very particularly pleased with this compound. I think it's beautiful. I mean, if I would be Michelangelo, I would make a painting of it. And it's, so Michelangelo, I know what I'm talking about, was my favorite painter at the age of 17, 18. And so I think this is a beauty. I mean, I once wrote an article and said, chemistry is a beauty forever. And that was inspired by this type of compound. It is a cyclam ring, but let's go back. I cannot have enough of looking at this structure. You have the cyclam left and the right, and you have the aromatic ring within the middle. Okay, now. So why I mentioned this is now becoming much more prosaic. The compound was originally discovered to be an anti-HIV agent. That was the purpose. And as a spin-off of that kind of research, the compound has been pursued as a mobilizer for stem cells. So it's it's the most beautiful story I could tell you for serendipity. I mean, its compound was then found as a mobilizer for stem cells during the preclinical and clinical I'd say exploration of this compound, and it was found to be so good that it was finally commercialized for this purpose and approved already 10 years ago. The original paper that I had written on this compound was ever sponsored by the very famous Nobel Prize winner Max Perutz, who became a good friend of mine, and he was so kind as to sponsor my paper in the PNAS, and that was back in 1992. Max Perutz and myself did, of course, not expect that this compound would ever make it to the market as a stem cell mobilizer. Practical application of this stem cell mobilization is for the treatment of some malignant diseases like non-Hodgkin's lymphoma and multiple myeloma. And now in 1 or 2 minutes left, I talk to I would say, the most important compound. This is tenofovir. Okay, everybody should belonging here to IOCB. I'm not going to tell in the temple of where Holý was born, to tell how his compound really looked like. But so the original publication on this compound turned out was 1992. You see the authors, with the most important author is the second one, Holý, and then at the last place it's Charlie, the one that is considered to be sponsoring the observation. Okay, the most important paper of this is not mine, but next. Next slide, I think. Maybe well, we will come back to that if we have 2 minutes. Okay, now I have to be even very fast. Okay, so I would go very fast with regard to all the compounds that you have seen so far, or all the formulations starting from tenofovir. So there are about 6 of them. I hope they are still at exhibition here. So, but you can see it there. So, and then more recently, then at Gilead, Bill Lee described the use of a compound which is a new derivative of HIV, of tenofovir. And it's a question which has been asked many times to me, and this is very important. How come we have, or also IOCB and Holý's, let's say, group have the rights on the new derivatives? That is because when we signed the contract back in 1991, we were given a rather small amount of money for the agreement. But instead of getting money, upfront money at that time, we arranged that we should also get patent rights on all the compounds that would ever be developed starting from tenofovir. So when tenofovir was developed as tenofovir disoproxil fumarate, that was the first product that was ever made, but we also got the rights on all the products that would ever be formed from tenofovir. And that, of course, was, let's say, a step in the dark at that time, but it turned out that TAF, tenofovir alafenamide, belonged to that principle. And that is the reason why our protection that originally was done as patent protection for TDF, the tenofovir disoproxil fumarate, was also extended for TAF. And TAF was originally then developed by Bill Lee and his colleagues at Gilead. So you can see among the authors also Thomas Stinar, who I'm sure you know very much about him too. I mean, so he was the one who moved from here to the United States to work with Gilead, yes? And so TAF then became known under the name of Vemlidy for the treatment of hepatitis B virus infections, but it has also been formulated together with many other compounds for, next, yes, so it's Descovy. This is then combined with emtricitabine, yes, then combination, here Descovy is a combination for the treatment of HIV infections. Next. Next. We have Odefse, that is a combination of TAF with emtricitabine and rilpivirine, Janssen's compound. Yes. Then treatment for HIV infections, where we have 4 compounds, TAF, together with emtricitabine, elfitregravir, and cobicistat, yes. Then the newest one, or the second to the last one, has been the Biktarvy, which has been a combination now, this time together with bictegravir, still based on TAF. And this compound, in the most recent report that I read from Gilead, is the one that does not give any resistance. Now I make a very big story short by saying, is resistance a problem? No, it's absolutely not a problem with this compound, for instance. So where we have the combination of these 3. So these are all, as you can see, formulations that have appeared. And this is a very recent one. And then even a more recent one is when we have the combination with the protease inhibitor, is darunavir. And that was recently also then commercialized, not by Gilead, but by Janssen, because of the compound darunavir is from Janssen. Yes? That I would skip. And then to end, this year is the year of the dog in China. And what you may not know yet, or may not be known yet here, is that one of the compounds that I've ever developed in collaboration with Dr. Holý also made it now in the world of the dogs for the treatment of a malignant disease. Dogs, quite older dogs, quite often develop a non-Hodgkin lymphoma. And so this was an indication for the use of the compound tanoviam for the treatment of non-Hodgkin lymphoma in dogs. This is veterinarian use, and it has been approved in the US for the treatment of this disease. So, symbolic for the year of the dog, that our compound, also Holý's compound, I mean, was ever approved for the veterinarian purpose. I think that is an explanation of what I told you, and so that brings us to the final slide. This is not chemical compound anymore. This is the building of the old institute. We have in the meantime moved to a new institute. This looks still a little bit more romantic because, as you can see, we have a bridge here, and I always referred when I showed this slide that all big and good institutes are located in a bridge. It's not just by accident that Cambridge is so famous. That is, you know, this is a little bit Leuven Bridge. Yes. So the new institute is a little bit less, let's say, prominent. I mean, you can always see these letters. It took several weeks even before I had found this institute, this new institute of mine. And so it's, then I would like to, I generally mentioned this building as it was the original laboratory of mine, but you would of course not believe that. This is the most important picture of the city hall in Leuven. It's certainly one of the nicest city halls in the world. I mean, it's, you see, I'm not chauvinistic. And then the next one, this brings you to the Mr. Rega, if we are called Rega, that is named after a certain Mr. Rega, who was once the rector of the university around 1730 or 1740. And the second to the last slide, that is a picture of my boss, my mentor. I had in my life only one boss, and I still cherish my good, absolute, superb relationship I've ever had with this person. He made my career to what it is this day. I mean, unfortunately, he will never have seen this because he died already in 1985. That's so long time ago. He has never seen all the results of the collaboration with Dr. Holý, but I would say that he signed the original papers because he was the man in power, and he signed the original papers at that time when we started the collaboration. He was a big fan of this collaboration, although he has unfortunately never seen the results of it. And so this is the final slide, is with what is called the Sede Sapientiae, that is the symbol of our university. And with the Sede Sapientiae, I would like to say thank you very much for your attention.